Good morning everybody. Myself is Prof.Dr.R.R.Deshpande. With me are the PG students as well, and we are making the Ayurved Panchakarma lecture series. Today is Thursday, that is 22nd of June 2017, and for the last few sessions we have completed the Ayurved Panchakarma series Snehana part, that is Snehan part 1, Snehan part 2, Snehan part 3, and now from today we will start another important karma of Ayurveda, that is Svedana. Svedana can be translated as a fomentation or sudation. Fomentation or sudation can be called as a Svedana. Actually this is a therapeutic sweating or therapeutic fomentation or therapeutic sudation, which can be considered as a synonyms of Svedana. Synonyms. What is the Svedana? This is the process by which one can relieve, Vaidya can relieve the stiffness, heaviness and coldness of the body. Three properties or three problems can be reduced: stiffness, that is stambha, heaviness, that is guruta, and coldness, that is shitata of the body, and also at the same time produces the sweat. This total process is called as a Svedana. Actually previously in my days, whenever to treat the fever cases, usually our doctors were not using much of the antibiotics or very strong NSAIDs. They were using very simple diphoretic mixture. The name for the mixture was liquid diphoretic. This is the pharmacological word, and the meaning of diphoresis or diphoretic, which liquid will produce the sweat. And you know very well, when you produce the sweat, your inner body heat will be reduced and your body temperature will go down. That's why we ask the patient to take some blankets. Whenever the patient is shivering in the chill, fever with chill, then we give the blanket. Because of the blanket, the patient starts sweating and automatically body heat is reduced. But here we want to develop the sweat for our beneficial purpose. That is the Svedana karma, that is therapeutic procedure. Actually physiology consider sweat, or in Ayurveda it is called as a Sveda. This is the waste product, one of the important three waste product, that is Purisha, Mutra and Sveda, that is stools, urine and the Sveda, sweat. So this is one of the waste product, and it also has a relation with the metabolism of the Medha Dhatu. It is very closely related with the metabolic process of Medha Dhatu or the fat. So whenever there will be problem with the fat, problem with the Medha Dhatu, there also we change in the sweat formation process. These obese people also get a more sweat. Remember, their axilla are always wet, but the Pitta Prakriti also gets excessive sweating. So there is a little bit difference. In the Pitta, if you consider the gunas, Pittam, Sasneha, Tikshnoshnam, Laghu, Visra, Sara and Drav. So Visra is a typical smell. Foul smell is called as a Visra. So how to identify if you are giving the two clothes having the yellowish patch of the Sveda or the sweater, and you are asked, now tell me which banyan, which inner garment is of Pitta Prakriti and which garment is of the Medha person. So both have the yellowish patch of the sweat. Then if there is a bad smell to one of the inner garment, that is definitely because of the Pitta Prakriti person, because Pitta has a Visra property. This is very practical consideration. Now what does this sweat do? Sweat also has a useful function in our body, because this is important mala. Ayurveda says that dosha, dhatu, mala all are important. Dosha, dhatu and mala, bioenergies, tissues and waste products all are important. That's why what is the siddhanta or principle? Dosha, dhatu, mala, moolam hi shariram. The word is moola. Moola are like the roots of the trees. As the roots are important for the tree, dosha, dhatu, mala are important for my body. So they are all the three are important, and everybody has its own function. Dhatu has their own function, doshas are having own function, mala is also having the important function. Actually, they are called mala because the nirukti is malinikaranat malaha. They actually spoil the body, but not in physiological condition. Remember, they spoil the body in a pathological condition. This is very interesting. Normally, they are doing the good function, but when they are abnormal, they do the malinikaranat malaha. Like for example, dushayanti iti doshaha. Same, who vitiate, who are disturbed the body, they are called as a dosha. But whether the doshas are vata, pitta, kapha are always destroying the body? No. Rather they are very good. They are doing they are structural and functional units of our body. Still they are called as a dushikaranat doshaha. Dushanat dosha. Why they are called like this? Because one must consider, if they are disturbed, then you lose your health, because they will destroy you. Similarly, malinikaranat malaha. Normally they are not bad. Stools, they are the waste product. They should go out at a proper time, in a proper way, proper manner. So this is then normal. But by chance, if you have the constipation, they are not going out. Stools is not going out. Then what will happen? The patient will complain of abdominal pain, abdominal gas. That is malinikaranat malaha. Then they are spoiling your body. Are you understanding? Sukshma kleda, going out of the body. What is the function of mutra? Mutrasya kleda vahanam. Function of the urine is explained in Ayurveda. In Sanskrit, mutrasya kleda vahanam. So kleda is a very minute, subtle waste product developed, created at the time of tissue metabolism. Tissue metabolism, dhatu vyapar, dhatu pachana. At that time, kleda is also forming. And if that kleda is not going out, then there is a problem. Normally it is going out through the urine. That's why mutrasya kleda vahanam. But urea, for example, urea is the important waste product going out through the urine. Now urea is not going out. What will happen? It will accumulate in the blood. And urea is not good for the body. That's why it is going out. It is a waste product of protein metabolism. When urea is inside in the blood, condition is called as uremia. Very dangerous, very bad. Uremia. And that uremia can be considered as malinikaranat malaha. So PG students must able to explain what is meant by malinikaranat malaha. It's very clear, this idea? Okay, now we will go further. So sweat, what is the function of sweat or sweda? Svedasya kleda vidhruti. There is a difference in the function of mutra and sveda. Don't get confused. Function of mutra or urine, mutrasya kleda vahanam. To remove out, to take out the kleda from every cell of the body and throw it out of the body. Transport of kleda is a function of mutra or urine. And what is the function of sveda or the sveta? Svedasya kleda vidhruti. Vidhruti means to hold, dharana karne, Sweda is responsible for keeping moisture in the body. It's very similar to the modern concept of water and electrolyte balance. Sweat is maintaining the water and electrolyte balance. That's why in the summer season we drink electral powder and lot of limbu sarbat, lot of water to maintain that percentage of the swed or the sweat inside the body. So sweat carry the water soluble waste product from the body and it is useful to cool down the body. That is why in the Grishma Rutu or summer we get a lot of sweating because inner body heat should be go out. Okay? And there is interesting part when any person is become unconscious or fall down because of the giddiness, vertigo or fainting attack in the summer season. Why? Why the patient? That is called as a sunstroke. You know this sunstroke. It's a unconsciousness, brain damage due to the excessive heat, and inside your body there is a heat regulatory mechanism. What is the word? Heat regulatory mechanism. That is called as a homeostasis. You know this word. Samyavastha, balanced state. Homeostasis. That is getting disturbed in the sunstroke. So very important feature of sunstroke. Normally everybody feels uneasy due to the lot of sweat. Oh, too much hot, too much hot. It is okay. It is okay because you are having a lot of sweat. That is a protective mechanism. But in the sunstroke, because of the too much heat, brain get damaged. Heat regulatory buttons off and then patient falls down. Important clinical feature. Patient looks very red and hot. His body, face looking very red. If you touch, it is very hot, like a shock. But there is not a single drop of sweat. That is important diagnostic feature of sunstroke. How you will diagnose the sunstroke? Tremendous redness, very hot, but no single drop of sweat. And what does it indicate? Brain damage. Heat regulatory system is damaged. Okay, let us move further. In Ayurveda, again it's a twin, Snehana and Svedana together. Always they are used together like a twin therapy. I can give the new name. If I want to teach to the foreigners what is twin therapy in Ayurveda, then answer will be Snehan Svedan, always together. It is not Vaman Virechan. Is it possible? Vaman Virechan is not twin. Basti Nasti is not twin. But Snehan Svedan, yes. As a Purva Karma, twin Purva Karma, I can give you the different name. Twin Purva Karma. What is that? Snehana and Svedana. That is pre-procedure before the Panchakarma or the detoxification process, purificatory processes. But like Snehana, it is not necessary that Svedan should be used only as a Purva Karma, only before the Vaman Virechan. No, no. You can use independently Svedana Karma for Shamana Chikitsa as well. Svedana Karma can be used as a Purva Karma, but also can be used as a Shamana or palliative treatment. Okay. So, by meaning of Svedana therapy, toxins are excreted out of the body, and this process is very much useful in the treatment of musculoskeletal diseases like Snehana, because it is a twin. So, you can use the Snehana as well as Svedana in musculoskeletal diseases like arthritis, rheumatism. You can use it as a in the metabolic disorders like obesity. and as well as Purva Karma for Panchakarma before the Vamana and Virechan. Now next, why it is done after the Snehana? That is also very important. Why Swedan is always done after Snehana? That is the important, sequence is important. It is not done at any time. Swedan before, Snehan after, Snehan before, Swedan after. No, always there should be Snehan first, followed by the Svedana or the fomentation. Lubrication first, then fomentation. Of course, there are some exceptions, but that we will discuss afterwards at the proper time. But 90%, 95% Snehan is followed by the Svedana. What happens after Snehan? Deeply embedded doshas become softer. They are becoming loose from their attachments. Stickiness will be loose. Amata will be reduced. And then you do the fomentation or Swedan that liquefy the doshas. Liquefaction. The Sanskrit quote is Svedastu dosham nayati dravatvam. The Sanskrit line is Svedastu dosham nayati dravatvam. Svedastu dosham nayati dravatvam. So fomentation always makes the Vata, Pitta, Kapha, especially Kapha dosh liquefaction. And because of the liquidity, they can come at their proper places where you are adopting or where you are giving the Vaman or Virechan. So if you are giving the Vamana, all doshas will come accumulate in the Amashaya. And if it is give the Virechan, they will come in the intestines. So they will come at the central place. Okay. So it increases the sweating and removes the toxins through the skin. Skin also becomes the more glowing and soft, and because of the softness, the skin also, what you can say, the become more elastic. Elasticity is more important. Flexibility is more important. So elasticity and flexibility definitely can be improved after Snehana and Svedana. And improving the flexibility, improving the elasticity is a need in the old age. Anti-geriatric treatment. You should be more flexible, your joint should be more flexible, and your skin and texture should be more elastic. Your organs should be more elastic. Your sphincters should be more elastic. Your arteries should be more elastic. If they are hardened, then there are problems like arteriosclerosis, atherosclerosis, locking of the jaw. All these are the problems of the old age. Okay. Peristaltic movements less. Why? Because of the stiffness, because of the loss of elasticity. But if you do the Snehan Swedan, his intestinal movements will be good, his stools will be good, his urine will be good. So there is no problem of constipation, no problem of kidney failure, no problem of the heart damage, because every circulation will be good. Srotasats will be in a very good condition. Srotasats will not become more stiff, rigid and hard because of the Snehan and Swedan together. Next, physiologically for the healthy person, Swedan is recommended in early and late winter, like Hemanta and Shishira Rutu. Everybody should be advised to go for oil massage and steam bath. That is very much essential to maintain your swastha or healthy condition. That can again act on the skin, it becomes more soft and moist. So there will be no cracking of your lips, cracking of your palm, cracking of your sole, nothing. Although there is externally cold, you will be more lubricated and having enough warmness in your body. Now if you do the Snehan and Swedan internally, that can improve your digestion. That is very important. Even simply you drink the warm water, that can digest your arm or the inner toxins, undigested part, and that will definitely stimulate your Jatharagni, your Dhatvagni and your Panchabhutagni. Simple drinking lukewarm water. Very simple home remedy. I have already told you, because of the Svedana or Snehan Svedan, stiffness is reduced. Heaviness is a Guruta. This is also the common problem nowadays. The patient, obese patient especially, or having the digestion problem, they always complain. In Marathi they say, माझा अंग जरा जड वाटतंय. I am feeling little bit heavy in my body, heavy inside my head. So that heaviness can be reduced if you ask the patient to drink the warm water. Heaviness will be definitely reduced. Some people feel, old people, that I am always feeling my hands cold. This is also very common complaint. My feet are becoming cold. Then of course you advise them to use the socks and the shoes or the chaplas inside the house. But at the same time, internally you can ask to drink the warm water. Simply warm water, or if you want more Svedana, you use some Ushna Tikshna Dravyas. For example, clove, C-L-O-V-E, very best, very best. You just put 3 to 4 cloves in 1 liter of the water, boil it, cool it and ask the patient to drink for the whole day, especially in this rainy season of June, July, August, September, and also in the winter season like November, December, January. Always drink this. Even another Svedana or another diaphoretic is your wet ginger, ardrak. In spite of the clove, if you don't get the clove, you can put the simple ardrak or the wet ginger, making a chops, and put it in the water, boil it, cool it and drink whole the day. Keep it in a thermos. Thermos will help to make the water always warm for the 24 hours. As per my Germany and Spain experience, this is very interesting part, that these people are following this Ayurveda every day, day to day life. They make them habit because they are 8 to 9 months they suffer from the cold. Very few months they have the bright sun. So they require this wet ginger processed water for throughout the year. And they are drinking this water, surprisingly, all German people. And they call this water in their language, you must write it down, Ingv Wasser. Learn German little bit. Ingv Wasser. Ingv means wet ginger. The meaning of Ingv is a wet ginger. And Wasser is a water. So it is nothing but Shunti Siddha Jala in Ayurveda. But in German, they will say Ingv Wasser. This is Svedana. Remember, this is Svedana. Next. Svedana will remove the Strotorodh. Remember, Strotorodh, obstruction. Wherever it may be in a macro strotas or it may be micro srotasa. Very interesting. Micro srotasa is nothing but the capillary circulation. Another word for Ayurveda says sthula srotas, sukshma srotasa. But examples, give the examples. Sukshma srotasa. That is nothing but the capillary circulation. So it will remove the blocks in the arteries and capillaries. That block may be because of the arm according to Ayurveda. But this arm which is making Strotorodh is nothing but either it may be cholesterol, am I right? Either it may be the atherosclerotic type of changes, deposition of the fat, deposition of the cholesterol. It may be the thrombosis. This is also Strotorodh. It may be the embolism. Yes. So it is very similar action like the antiplatelet activity. Very similar. Your warm water or Ingv Wasser Shunti Siddha Jala. So we must make experiments asking all the patients of AHD, ischemic heart diseases, you must ask them to drink this Ingva Vassara or Shunti Siddha Jala. Another patients you can use when the patient has suffered from the stroke. STROK is stroke. It's also called as CVA. CVA, cerebrovascular accident. Cerebrovascular accident is nothing but stroke. Is nothing but the patient will suffer from hemiplegia, pakshaghat. There is also three reasons: hemorrhage, thrombosis and embolism. Three reasons for hemiplegia. But remember, when there is hemorrhage, Swedan will be contraindicated. Am I right? Whenever the patient is having hypertension, blood vessel has broken down, cerebral artery is broken down, Charcot artery is broken down, no use of Swedan. Don't give Swedan. But thrombosis and embolism, after 15 days, after 1 month, start immediately Svedana karma with internal drinking of processed warm water. Then there is some phenomena because of which there is arterial spasm. That's why you must know some modern diagnosis. It's called as Raynaud's disease. R-A-Y, Raynaud's disease. Write down this name. These patients are coming to your clinic, Raynaud's disease. The patient will complain that my fingers are becoming cold, bluish, because of the spasm in the vessels. This is peripheral vascular disease, PVD, peripheral vascular disease. I think when we learned this Panchakarma, Snehana Svedana in olden days, I don't think much of the discussions on this line was there. No Charak Sushruta Vagbhat is mentioned in this way, and very few teachers are explaining this way. But this is very important for better understanding. Raynaud's phenomena is one of the condition of perivascular diseases. Then there is also TAO, like of complaints, artery obliterans, transient artery obliterans. So there is also some spasms. Then there are conditions like DVT, deep vein thrombosis. Here also all the things we can use internally as well as externally. Svedana karma, fomentation, sudation, to remove the strotorodha, and after removing the stroto, because Ayurveda says rogaha sarvepi mandegnau, this is one of the quotation, but another is a root cause of disease is strotovaigunya. It is also called as a Kha-vaigunya. Kha is for srotas. Kha means akasha, ether. Kha means hollow space. So, because of this srotovaigunya, the main problem is, you know, the sroto dushti lakshane. Ati pravrutti sangova siranam granthayopi va vimarga gamanam chapi srotasam dushti lakshanam. Don't get tension of the shlokas, because I remember some shlokas. But this is important shloka of explaining the stroto, the dushti lakshana or the clinical features. The main thing happens, main pathology, because of the stroto dushti or stroto vaigunya, there is a disturbance in vata gati. Vata gati is disturbed. Remember that you must write down vata gati. direction of Vata. In Ayurveda it is called as a Vatanulomana. Vatanulomana. What does it mean? In every space there should be some specific movement. If you consider the peristaltic movements, if you consider the nerve impulse, if you consider the NAK pump in the cell membrane, so all these are the activities. If any activities is disturbed, that is called as a Vatanulomana is not proper. Suppose my coronary is not giving a proper blood because of the thrombosis, that is called as Strotorod, and Vatagati is disturbed. If I am getting vomiting, normally food should go from stomach, duodenum, jejunum, ileum, colon. But there is excessive anti-peristaltic movements. I am saying anti, in opposite direction. So Vata becomes Pratiloma and you get the vomiting. So what I mean to say, whenever you find Strotorodha because of the Kapha and Ama, there will be disturbance in the nerve impulse. There will be disturbance in blood circulation. There will be disturbance in hormonal flow. There will be disturbance in secretion process. Am I right? If my salivary gland is having some inflammation or even the stone inside the salivary duct, what will happen? There will not proper salivation and I am getting the pain over here, that is Vata Pratiloma. Vatanuloma Gati has been stopped. So everywhere you can see these conditions. Just now we have talked about sunstroke. What is there? Sweat is not coming out, and that is called as a Vatanuloma is not proper. But when you ask the patient to take the blanket, if you give the paracetamol, if you give the Tribhuvana Kirti, this is all Svedana. What will happen? The sweat glands will be stimulated. Then flow of the blood will be there, vasodilatation will be there, and sweat will start coming out from the hair follicles. So, Sveda Vaha Srotasa, obstruction is removed with the help of Svedana or diaphoresis. Is it clear? So, this is something, modification that you must understand of Svedana Karma. Now next we will go, like a Snehana, we will try to understand the pharmacodynamic and pharmacokinetic of Sveda Dravyas, the substances that we are using for Svedana. What is the pharmacodynamics and pharmacokinetics? So we must understand the properties of Svedana Dravyas. First property, Ushna. Svedana Dravyas are always Ushna. Like I have just now told you, one of few examples are the hot water, any spicy substances. Then I have mentioned about clove, I have mentioned about the ginger. All the spices, moreover, they are of type of the hot. Simple things, if you consider the coconut oil, for example, is not at all hot. But if you consider, what is the word for that mohri oil? Yes, loudly, mohri. The Marathi, it is called as a mohri. What is the English word for it? But anyway, you find out that word. Mustard oil. Thank you very much, Gauri. Mustard oil is definitely Svedana. Remember, because mustard is hot. So, Ushna or the hotness is a property of Sveda Dravyas, and because of only vasodilatation takes place. The action will be vasodilatation, blood circulation will increase and perspiration takes place. This is the pharmacodynamic and kinetic, and because of that it is used to remove the stiffness and spasm of the muscles of arthritis. Even there is a backache, sprain is there, then we ask the patient to take hot water bag and foment it. Simple thing. So this is pharmacodynamic. Next is a Tikshna Guna. So Ushna will make the vasodilatation. One word you must write, vasodilatation. Tikshna, penetrating. Tikshna always penetrates deep. So all these dravyas can enter into the very minutest cell in our body. No place will be escaped. It will enter through the semi-permeable membrane and directly go inside. So this is the property because of the, like a sword, knife is a tikshna. So it cuts the body. Similarly, these dravyas physiologically will cut or enter into the semi-permeable membrane, and it can act at the minutest cellular level. Action is not gross, because many people they ask you, how your dravyas are acting. You are applying externally, what it will do? Then you tell them this is pharmacodynamic. The dravyas are having the action like knife. Knife is entering inside. Similarly, my dravyas are, although we cannot see them, but they are entering inside the body. Next. So, as they are entering deep inside, they can take out the doshas from peripheral tissues. Even they can enter up to the further body tissues like mausa, meda, asthi and majja. Till the brain, these dravyas can act very well. So, any pathological site which is having the root inside, that will be taken out. So, it is very interesting even for the cancers, the cancer, the cells are more invading inside. So, to take out them, there will be also Swedan will be definitely helpful for the cancer patients. Pathology is taken out from the very deep. Then Sarata, Sara is also spreading quality because of the liquid part. Sara Gund gives the ability to spread, and that's why they are covering the more part or more organs of the body, liquefy the doshas, take them out from their minute cavities, and that's why we are using them as a purva karma of Vamana Virechana to bring kapha in amashaya in the patients of bronchial asthma. Next property of Svedana Dravya is Sukshma, that is minute. So very well we know that when the substance is gross, it cannot enter inside. But when the substance is small, the simple practical example I give you, when we ask the patient to take a big size of the tablet, it's very difficult. Then what we do, especially for the children, we crush the tablet, crush. So crushing is nothing but the Sukshma. We make the molecules small and then they can enter very easily. If the substance will be gross, it cannot enter inside the body. So Svedana Dravyas are always Sukshma. It can reach into the very minute cavities and minute channels, even through the capillaries and semi-permeable membrane of the cell to perform their function. Okay. Next part of this Svedana Karma is material that we are using for Svedana, and after material we will go for types. But first, in this particular audio session, we will only complete the materials. Material that we use for the Svedana, they are of two types basically, as you know, liquid and solid. Either the material will be solid, like for example, if you take the infrared lamp, it is a solid, and if you take as just like the hot water, then it will be the liquid form. Okay. Then there may be also another category like oily fermentation and dry fermentation, snigdha and the ruksha. Oily fermentation and ruksha, for example, when you give with the steam water vapor, that is the snigdha ushnata or the oily fermentation. But if you ferment it by the sand bags, they are making hot, and only because of the sand bag, that is a ruksha sved, that word dry fermentation. So let us take some examples of the material. First, commonest is a water steam. used in the Nadi Sveda according to Ayurveda. Nadi Sveda can be translated as a tube fermentation, tube, because we are using the tube of special quality. Then there are also some, the containers are available for the cosmetic purposes. What they are called as you get the steaming, what they are called as? Steamers. That's right. Thank you, Gauri. Steamers. This is the advantage of English medium. You immediately recall those words. Steamers. That's right. And they are very cheap, Even 150, 200 rupees you get a small box. You have to just put the water, put it the connection to the electricity, and the steam will start within 2 or 5 minutes. Am I right? And that you can take on the face by covering your head and eyes. That steam is not for only cosmetic purpose, but especially all the patients of upper and lower respiratory tract infections. If the patient is having the congestion in the nose and he cannot breathe at night, emergency, he cannot go to the doctor and take the nebulization. But disease steamer is nothing but the home nebulizer. Home nebulizer. And as I have just now told you, you can add little bit clove, you can add little bit ginger, that is more beneficial. In spite of only water, take the medicated water steam. Am I right? So this steamer is very useful in cases of the upper respiratory and lower respiratory, sinusitis, bronchial asthma, spasm will be reduced definitely. It works just like a nebulizer. And in the nebulizer also we put the salbutamol, the asthalin drops. So in spite I have asked you to put some ginger or the clove. That is also same action like relieving the bronchospasm or bronchodilator. Remember. Next is a milk. Milk can be used, remember, for the fermentation. So milk fumes are also used when the patient is very debilitated patients, or the chronic wounds are there and you want to purify it. So degenerative type of arthritis, slip disc problem, what even we call it as a PID, prolapsed intervertebral disc. So patients suffer from backache. So milk can be used as a nutritive. The best Svedana karma with the milk is Shali Shashtika Pinda Sveda. Very famous therapy in Ayurveda. Shali Shashtika Pinda Sveda. Shali is a rice. Shashtika means 60 days. 60. Pinda, you are making the bolus. And Sveda, Shali, fermentation. Shali Shashtik Pinda Sveda. Fermentation with balls of rice which grown up in 60 days. It has some specific quality. So Shali Shashtik Pinda Sveda is the best treatment which includes Snehana as well as Svedana. Remember, rice is cooked in Bala decoction. Bala is the name of the herb, Sida cordifolia. And then after cooking the rice, bolus are prepared, and then bolus is also in between make the hot with the use of the sesame oil as well as the use of the Bala decoction. Both hot preparations are ready and the bolus are put it over there and then rub it on your whole body. So this is very, very interesting therapy. We always practice in the Europe and all the foreign countries because there are a lot of patients with neurological problems. This is excellent treatment for all brain problems. Just yesterday I had explained you all degenerative of myelin sheath, degeneration of the myelin sheath. For hemiplegia we are using here. But if you go to the Kottakkal, you will find the admitted patients of multiple sclerosis. Sclerosis is a very common disease in Europe, demyelinating. Then GB syndrome, Guillain-Barré syndrome. Then you will find motor neuron disease. 3 words you should not forget: motor neuron disease, GB syndrome and multiple sclerosis or amyloid lateral sclerosis, ALS. Sclerosis word you should not forget. Write down these three things: GB syndrome, Guillain-Barré, then multiple sclerosis, then what else I have told you? Third thing, ALS, amyloid lateral sclerosis. Multiple sclerosis is different. Amyloid is a type of amyloid lateral sclerosis. And last but not least is very important is a motor neuron disease. Never forget it. Motor neuron disease is a fatal disease and very dangerous disease. Motor neuron disease. Of course, the hemiplegia is also there as an indication, but then in addition to that, you can use it for muscular dystrophy and muscular atrophy. Both the conditions, muscular atrophy and muscular dystrophy. Also, you can use it to develop the muscle mass, muscle bulk. You want to improve the patient's weight because patient has lost many kg weight, by which he becomes the cachexic. The word is cachexic, C-A-C-H-E, cachexic. It is called as a skeletal. Body becomes like a skeleton. So in all this, because of the cancer, because of the HIV, and because of the tuberculosis, these three diseases you should not forget for the cachexia. Reason for cachexia. What is the three causes? Tuberculosis, cancer and HIV. Reasons for cachexia. There also you must use Shali Shashtika Pinda Sweda. Swedan Karma. We are talking about Svedana Karma, but most practical useful information. Then plain sesame oil you can use by making it hot, because this is a good vehicle. Basically, Taila is itself is Tikshna and Ushna and Vyavai. You know the properties of sesame oil. It is not like ghee. It is opposite. Ghee is a lubricant. Ghee is a snehana. But Taila or sesame oil is a Svedana by itself, inherent property. And that is the base of different medicated oils. So it will carry the property of sesame oil, Ushna Tikshna. So always heat is also given by rubbing the sesame oil or different medicated oils like Dhanvantaram oil is a nourishing oil, Sahacharadi oil, Antivata for the lower part of your body, Vishagarbha oil, not rubbing, only application, that also can make fermentation. Only application, Vishagarbha, hot oil, lukewarm oil, for muscular stiffness, to remove the spasm and stiffness. You know, there is a after effect or the udarka or the upadrava of rheumatoid arthritis. Muscular contractures are very common after the disease of rheumatoid arthritis. Muscular contracture is very common. Hastapada Vakrata in Ayurveda, explained in Vata Rakta disease. Never forget it. So muscular stiffness. Then Murivenna oil, I have also described yesterday, for traumatic injuries and swelling. Murivenna. When I get a bad any hit by stick or any stone and I am getting a pain, then I must use the Murivenna oil. Then for Svedana Karma, you can also use skillfully cow's ghee or medicated ghee. Although ghee itself is a soft and cooling in nature, but when you heat it, it can carry the properties of heat as well. So you can use the Triphala ghee, Yashti Madhu ghee, for different purposes, but mainly I will say for purpose of what you can say the Svedana Karma, better to use the oils in spite of the ghee. Ghee is not so much favorable for these things. Then you can use the kanji or meat or salt especially in the traumatic swelling for the Pinda Sweda purpose. Pinda Sweda. Then different herbs are used for Samskarana or for processing for the Svedana Karma. These plants are very much useful, like Vacha, Acorus calamus. Simple Vacha powder is a fermentation, remember. And even in our tradition, in our families, our grandmother and the mother, they are always use this Vacha powder application to the small child of less than even 1 year after the shower or after the bath. They apply a little, very little, and it's not too much rubbing, because if you rub too much, it will create the inflammation. So for the precaution for the Vacha oil, it should not be rubbed heavily, vigorously. And second thing, just application can make the body much warmer, and it can protect from the cold. Nowadays, for example, you always keep the Vacha powder at your home in the rainy season and winter season. Whenever you are drenched because of the heavy shower and you are wet and you go at home and you feel little bit cold and shivering, immediately make your body dry and simply apply Vacha powder, hands, feet, chest, neck, enough, and you will feel warm, very fresh. And drink then ginger processed tea. Very simple things to follow after waiting or getting wet due to the rain. Simple remedy of Svedana Karma, application of Vacha powder. The patients who are coming for the problems like my hands are always cold, my feet are always cold, there also you can ask the patient to apply either Vacha powder or mustard powder, as you said. This is also hot. When any patient of your practice, one or many people are visiting to the cold places. For example, they are going to Himachal Pradesh. If you are there going to Kashmir, if you are going for the Kailas Manas Sarovar Yatra, if they are going for trekking like Everest, and you are their family doctors, never forget to ask them to carry with them this Vacha powder and mustard powder. And whenever they feel any wrong, because you know, like hot, extreme cold can also make you burn. That is called as a frostbite. Frostbite. Even your fingers and toes, they are not covered, and unnecessary you are making some daring in the very snow region, then it can happen that there will be cyanosis to begin with. And if you don't care for it, that will terminate into the gangrene and the finger will be dropped down. This is also possible in extreme condition, and this happens. Even some gets buried into the snowfall. The person who gets buried, he may survive, but he may lose 1 or 2 or 3 fingers. So basically we should protect them by Ayurvedic Svedana principle by application of the Vacha and the mustard powder. This is very interesting. Then there are other plants like Rasna. I will tell you the tradition which is followed in Kerala and not in Maharashtra, application of Rasnadi Churna on the scalp. Write down. Application of Rasnadi Churna on the scalp after massage, after Shirodhara, after Kaya Seka or Pidichil. These people, they apply invariably, without forget, Rasnadi Churna. They don't carry Vacha Churna. They always apply Rasnadi Churna. Whenever you visit to the Kerala, you will find Rasnadi Churna. In foreign countries where I am running, Spain, the health center, I am also using the Rasnadi Churna. So this is very good to prevent it from the watering from the nose and eyes. Cold, prevention from the cold. Rasnadi Churna is a very good tradition to application on the scalp after the Ayurvedic procedures. Then Erandamula ricinus is also helping for Svedana Karma. Jatamasi is one of the herb that is using turmeric. It's very good antiseptic as well. Dashamula. All these dravyas are used in Nadi Sweda or Bashpa Sweda. I repeat the names, like for example Dashamula, Rasna, Erandamula, Jatamasi, turmeric, Vacha, this type of the bharad powders. Remember, when you have to put for Nadi Sweda in the pressure cooker in the water, you should not use the fine powders. They should be coarse, C-O-A-R-S-E, coarse powders, that is bharad churna in Ayurveda, which we use for the decoction purpose. Okay. Next we are using some leaves of Nirgundi, very famous plant, Nirgundi, Patra, Erand, Shigru. All these leaves we can use as a Patra Pottali Sweda. Another procedure of Svedana is a Patra Pottali. Pottali is always bolus, bowls. They are prepared with cooking these plants or cooking these leaves and then making the bolus with addition of some lavana, etc. Then, as I have already told you, sand is also material. Sand is used. Brick is also used, but very rarely. But sand is common. You can put the sand in the bags, and sand bags are ready in every dispensary, every clinic. Sand bags are ready. That is used for the Ruksha Sweda, for the Ama Avastha of musculoskeletal problems. So, my dear friends, on today, that is the Thursday and 22nd of June 2017, I have started Ayurvedic Panchakarma lecture series. The topic discussed today is Svedana, that is fermentation or sudation. First I have explained the introductory part, and then I went to describe about pharmacodynamic and pharmacokinetics of Svedana Dravyas, and lastly I have covered which are the different material that we can use for the Svedana. This is all for today. Thank you very much for patience hearing, and I all of you request to because I am uploading all these audios on the YouTube, very popular social media. So please subscribe this channel of YouTube, and then you will get intimation of different of my uploads. So thank you very much. Take care for yourself and the society, and have a nice day ahead. Thank you very much.